present our surgical technique for the treatment of intrastromal corneal rings segments extrusion. Intracorneal ring segments are used for the treatment of primary and iatrogenic ectasias, as well as for correcting irregular astigmatism secondary to penetrating keratoplasty. The most common complications of Icrs are infectious keratitis, sterile infiltrates, tunnel deposits, epithelial defects, segment migration to the keratectomy, and tunnel neovascularization. Dislocation of the ring to the anterior chamber and extrusion are some of the most severe complications. During the extrusion, the ring migrates to the corneal surface, which results in the opening and necrosis of the tunnel. Among the causes of intrastromal segments extrusion is an overly superficial implantation. Another cause is an overly narrow channel, which may cause a segment to migrate towards the keratectomy, thus causing a chronic lesion, which could in turn lead to the ring extrusion. Traumatism or excessive eye rubbing may also cause extrusion. Extrusions sometimes happen in very advanced keratoconus cases, in which the corneal thickness appears to be extremely diminished and the risk of segments becoming superficial is higher. Our surgical technique is based on the removal of the extruded ring, exchanging it for a thinner or shorter one, followed by the sealing of the tunnel with the biological glue Tissue-Coll. Tissue-Coll is a biological adhesive approved by the FDA. Its action mechanism simulates the last stage of the physiological blood coagulation, in which the fibrinogen turns into fibrin through the action of thrombin. Its active principles are fibrinogen and thrombin, a proteinin, calcium chloride, plasminogen, and fibronectin. It is used to promote tissue adhesion, to seal cavities, as a suture support, and as adjuvant treatment when standard surgical techniques are insufficient to improve hemostasis. Fibrin increases keratocyte proliferation, prevents corneal necrosis, and has an active life of 14 days after application. The first step of the technique is the extraction of the expelled segment. Then we check the aperture size of the tunnel wall to decide if a new ring of less thickness or shorter length can be implanted. At this point, we check the tunnel depth with a Suarez spatula. We perform a dissection at the same level to where the edge of the other segment is located. We select a ring of the same length, 160 degrees, but 15 microns thinner than the previous ring, which was 250 microns thick. Once the segment is in place, it is important to dry the corneal surface before applying the biological glue. Tissue-Coll is introduced in the tunnel with an anterior chamber cannula. To conclude the process, sealing of the tunnel is performed by compression with Albertazzi tweezers. Once the tunnel is sealed, a therapeutic contact lens is placed for 2 weeks. In this case, we perform the same surgical technique. We replace a ring of 250 microns and 160 degrees with a 250 microns and 120 degrees one. Same thickness, shorter in length. One 10-0 nylon stitch is placed for better sealing. post-operative treatment consists of a therapeutic contact lens for a week, tapered corticosteroids eye drops for 2 weeks, and a levofloxacin eye drops for a week. These images show the 6th post-operative year of both patients. Corneal rings remain in situ and keratoconus is stable. Using biological glue in the treatment of intrastromal segments extrusion is safe, effective, and produces a stable effect. The expelled segment should always be exchanged for a thinner or shorter ring. The results have been satisfying for at least 6 years, and this is probably due to the inductive effect of fibrin in keratocyte proliferation. Furthermore, there has been a noticeable interruption of corneal necrosis thanks to the use of this biological adhesive, which will help to prevent future extrusions. Therefore, biological glue not only aids in treating extrusion as a mere tunnel sealing agent, but thanks to its properties, it can also stop biological processes that may appear during the extrusion process.